Hello ladies, and welcome to our behind the scenes what happens when we go to the GYN. On tonight, we are going to discuss the basic GYN office visit, what happens when we go, and I'll give you some tips on how to make the visit a little more comfortable. So first, when we go into the office, we always get our blood pressure and weight checked. Then, of course, is taking off everything, all of our clothes. Everything comes off, even our socks. Well, we can leave our socks on, but everything comes off. Now, the first part of the exam typically is the breast exam. So with that part, we're going to look at the breasts, make sure that they look equal, that they look even, that there's nothing that we can see as far as lumps or changes in the texture of the skin. Then, of course, we go into the actual examination part where we feel the breast. And that's to look for any lumps. If there's anything that feels painful, checking under the arm because there's breast tissue under there as well. And finally, with the breast exam is checking to make sure that there's no discharge coming from the nipple, that there's no bleeding and no pain in that area as well. So that's the first part, and typically that's easy. We can get a breast exam done and not feel too uncomfortable. Then we get to the vaginal exam. So same thing, we're going to look and make sure that everything looks normal and even, that the skin on the outside lips of the vagina looks normal. There's no skin changes, no bruising, there's no bumps, there's no sores, there's nothing that's painful there, no cysts. And then we go into the internal exam. Now with the internal exam, that uses our trusty friend, the speculum. We have all seen these ladies for the most part if we have been going to get pap smears done. These come in different sizes. This one is a medium and is the typical size that your healthcare provider will use. But based on your comfort level and also mainly based on your anatomy, we may need to use the small one, which is probably about half the width of this one, or the large one, which is maybe almost double the width of this one. But it's based on your anatomy and what we need in order to see what's going on the inside. Some speculums, they're plastic, which are disposable, and some are metal, which means that they get sterilized after each use. The plastic ones, though, will allow us to see the walls of the vagina, and of course, both of the speculums will allow us to see your cervix. So this would go into the vagina, and then it opens. So when it opens, typically this is when we feel most of the pressure. So when it opens, hopefully we are at your cervix. Now this is a bit bigger. I made it bigger just because we needed to see it bigger for the video, but our cervixes are typically not this big. But nevertheless, once the speculum has entered into the vagina, it'll open up right to the opening of the cervix. And that little hole there, sometimes it's round, sometimes it's a different shape, but it's called the os, and that's just the entryway or the opening. Now, once we see that part, of course, we're going to look to make sure we don't see any bumps on there, nothing that looks off, nothing as far as masses or lumps or things called polyps or anything that wouldn't be correct in that area. We want to make sure that the coloring is right, and that goes for the walls of the vagina too, to make sure everything looks normal and healthy. Now the pap smear comes. So the speculum is in, we can see the cervix, then we take this brush. It looks like a broom. It's not hard, but the bristles, they're flexible. So they're like plastic flexible bristles, we'll say. So these will go right into the os, and it spins around. And then we take the cells that we now have from the cervix that are now on this brush. It goes into the vial, which has a liquid in there to preserve it. And then we swish it around and we'll send this vial off to the lab. And then the lab will tell if the cells are normal, if they're not normal, if there's cancer cells, if there's anything else going on. And typically we'll do testing for gonorrhea, chlamydia off of this pap smear as well. So that, ladies, is the exam. Now, why is it so uncomfortable? I mean, in all honesty, typically when we go to our OBGYN, it's not someone that we know very, very well, especially if it's your first time seeing this particular healthcare provider. So, I mean, it's almost like you're bearing your whole self in front of a stranger. So naturally with that, we'll be a little tense. And sometimes too, if we anticipate that it'll be uncomfortable, we're going to be tense as well. So those muscles that are down there in that area, once they tense up, it makes it more difficult to get the exam done, namely to get this part in, and it makes it uncomfortable at that part. Now, one more part I forgot to even say. So the second part of the exam down in the vagina is the part where we have to feel inside to make sure everything feels normal. Typically, this is done with 2 fingers in the vagina, and we're checking to see, does your uterus feel normal? Are there fibroids? Do we feel any lumps or tumors? Is there any pain? Also checking to make sure your ovaries are all right. Are there any tumors, any masses that we feel? Are your ovaries tender when you have the exam done? So we can check all of these other things. Going to the GYN is not just about getting a pap smear done, but there are many other things with our bodies that we need to have examined as well. So from that point, now let's talk about how can we make this a little more comfortable. So one tip that I always give my patients when they come if they are nervous is, let's say our legs are closed like this. So what we want to do, let them flap. We want to try to let our legs go out as much as they can, because this will naturally relax those muscles that are down there that tense up. I tell my patients like this, don't clench up your butt cheeks, because that's going to make it more uncomfortable. All of those pelvic floor muscles, once they tense up, it's going to make it more uncomfortable to have the exam done. So as best you can, just let them flap out. You can practice this at home so that you're used to that position and allowing things to relax. So when you go, it's not so uncomfortable. I promise you, ladies, that will help your whole life when getting this done, especially if you dread it and it's uncomfortable for you. The other thing is, while getting the exam done, of course, things like deep breathing or things like counting down from 10. The exam does not take that long. It's some seconds. Of course, it's going to feel like it's minutes, but it's some seconds. But do a countdown. Other things you can do is you can talk to your healthcare provider if you feel comfortable doing that. Some women do, some don't. But that's a good way to take your mind off of what's really happening, to have some kind of a distraction. Now, the other thing too, so of course I mentioned that when we go into the office, we usually don't know our healthcare provider that well, especially if it's the first couple of appointments. You can always, though, make an appointment as a new patient even, just to meet your healthcare provider. You can do that before any exam happens, so that way you know if you feel comfortable with this person, and then hopefully as time progresses you would feel more comfortable and you won't be so tense when you come in. So those are some tips just to help make it a little bit more easy for when we go. These are tips that I even use myself, because it is an uncomfortable exam, but it is necessary and it's important. It's a way that we show ourselves that we love ourselves and that we have to take good care of ourselves. And it does go beyond just checking for a pap smear for cervical cancer, especially for those of us that can go to the GYN for pap smears every 3 to 5 years based on our history. It doesn't mean that you skip out on the GYN for every 3 to 5 years. We still need to go every year. It's just the decision of whether you get a pap smear done that year or not. So I hope that this helped you guys. Like this, share this, send it to a friend. If you know someone who is nervous about going, send this to them, because once we understand what exactly is happening, it makes the anxiety about the event not be so great. So I look forward to seeing you ladies again soon. Let me know what else you want to discuss when we have these little quick videos to give us some information for behind the scenes. So drop me a comment, let me know what other topics you want to discuss and talk about, and I will see you ladies soon. Be well.